Sir.
Thank you, Minister, for first of all, Desmond Murray from Mayor of the Lachlan Shire. Thank you, Minister, and your team for coming out in the country. We do appreciate it, and it's glad that we can catch up with you. Lachlan Shire, I'm just going to follow up on the Tottenham issue, which encompasses in our Shire. And I'm going to put a suggestion, or not so much a suggestion, perhaps an idea which I feel that would solve the immediate problem until such times as the local health council or district can recruit a doctor. Now, you've heard what's happened there, but there's plenty of room there and scope there for a full-time doctor. We've had one there for many years, and we've been looking for one since 2007. So that's 5 years. We've had a few people come and approach, and we were led to believe they were coming, and then they disappeared again, and this has been going on and on. So what's happening is we're going to lose the hospital. The Shire has an involvement in that. We put money into the surgery, which is incorporated in the new centre there. So it's important for us as well as the community. My suggestion is that in Condobolin we've had those problems for years, and as you are aware, we contracted Oka Health to supply our doctors. And this has started to work, and as also you'd be aware, they have quite a number of other areas around the state also. Why shouldn't why couldn't the local health council, Western District Health Council, contract Oka to put a full-time doctor in there, whereas they seem to be able to find these doctors? It might take a little while, but they will obviously find one. Yes, you'll say that'll cost some money, but what's the cost if you don't? That's the question you've got to look at. And that's what I'd like to put to you. Secondly, just a second question on just on the capital works. We as a council have had to build new houses, new surgery, supply cars and things to look after our medicos, doctors and things right across the Shire, not only just in one town but in 3 or 4. Our local hospital or nursing quarters at Condobolin and Lake Angelica, which I appreciate has been shifted into Murrumbidgee but was still under the Western District before, they are nearly impossible to live in. How are we expected to get nurses if we can't have somewhere for them to stay, and that is acceptable these days? And this is a problem that's been getting put off and put off and put off, and I'd just like to draw that to your attention that it is pretty important.
Again, the old workforce issues. I think Robin?
Yeah, thanks for that question. I think, again, it comes down to workforce is such a fundamental issue. What I'm heartened greatly by that we have now gone to a local health district with a board is that I believe that we'll have much more flexibility about how we can address these things. Under the old system, there were very tight constraints about what could and couldn't be paid, and what could and couldn't be invested in. And I think that we very much see that the vision for our communities is that we need to get workforce sorted out, and that's probably our greatest priority. And as I said, I'm heartened by the fact that I think that we will have much more independence and accountability to do that thing. And I think that forming partnerships with local government, with other agencies, to come up with local solutions is what we need to be doing. And I'd much rather we were paying clinicians of all sorts more money themselves rather than paying third parties. So, you know, that's something that I think is going to be very high on our priority, and I would very much welcome your suggestions if you want to drop me a line so that we can incorporate those into our workforce planning. Workforce planning is fundamental, and we've got to think outside the square. Yeah, and that goes for the nurses as well. I mean, there's no point having a hospital if you've got a doctor there without nurses to support and work as a team. So this is fundamental, and it's something that's very high on our priorities, and that across the whole clinical spectrum.
Again, I remember being at a meeting where people were arguing about doctors and nurses and the sort of, you know, what they cost and all this sort of nonsense. And I said, look, can I remind you that without doctors, you know, this becomes a nursing home without nurses. This becomes a pile of bricks. I know it's an excellent yes minister scenario where, you know, the best hospital is the one without patients, but that's not what we've got to do. So the workforce, and I think the board's really aware, you know, of that and really works towards that. And I think it's going to be one of the big priorities for the next couple of years.